Looking good at 70 is one thing. Recognizing the people in the room with you is another. One of those you can still influence right now. I'm Dr. Kate D, founder and medical director of Glow Medi Spa, and this is Med Spa Confidential, where we expose the risks, the red flags, and the outright illegal practices happening inside med spas right now, because you deserve to know what's actually going into your body before you say yes. Today, I'm joined by Dr. Stephanie Rogers, a board-certified internist and geriatrician and a professor of medicine at UCSF. Our audience cares about aging well, and she studies what actually works for your brain. You'll find out which two midlife factors carry the most weight, and you'll learn why the statin rumor spreading on social media doesn't really hold up. You'll find out where GLP-1s really stand once you look past the headlines. And you'll learn why your daily crossword isn't doing what you think it's doing. Stay until the end to hear the 2 shots you can get at any pharmacy right now that are linked to a lower dementia risk. So, Stephanie, thanks so much for speaking with me today.
Of course, I'm happy to be here.
Let's just start with the word dementia. So when we talk about dementia, many people just kind of assume it's a geriatric disease and they don't even want to think about it. And I think a lot of people think that there's not much they can do. But I think that there are a lot of preventive things. So I'm curious to know your take. What portion of it is controllable, and what are the main things that you can do to prevent it?
Dementia is kind of like a global term, and then there's lots of categories of dementia under that. And some of them are genetic, but we do know that a lot of dementia is preventable. Up to half of cases can be prevented. And there was a really big paper that was released last year called the Lancet Commission on Dementia Prevention. And they were this group of international experts in many disciplines, and they reviewed all of the scientific literature out there. And they came up with the 14 things that have really strong evidence that you can do to actually prevent dementia. So there's a lot that we can do.
So that's a lot. That's a lot of factors. Okay. Uh-huh. So that's actually exciting for many of us who, that's sort of our biggest nightmare, right? We just, and you can't do much about your genetics, but okay. So there are 14 things. Why don't we tackle that in whatever order you want to go? Like, what's the biggest one? What's the one thing we can do? The number one thing?
Yeah. So what's interesting about this is they actually divide the factors up into early life, midlife, and late life. So there's things you can do at different stages in life. Midlife is where you have the most of the factors. So when you're like in your 30s to 60s, that's sort of the time where you can do the most to prevent dementia. Oh, there's only one early life factor, and that is education and educational attainment. The one thing that can affect us as adults is that there are studies that show that if you have a challenging job, a mentally challenging job, that can actually reduce your risk of dementia. So that's how education can kind of affect your dementia risk in midlife. But otherwise, the 2 biggest factors that are associated with a reduced dementia risk are in your midlife, and they are the correction of hearing loss, if you have that, and a normal LDL cholesterol. So those are the 2 biggest factors in preventing dementia.
All right. So hearing loss is really interesting. I do think a lot of people are a little bit in denial about hearing loss and wait kind of a long time. So tell me about that. Like, are most people who are losing their hearing aware of it?
So not necessarily. And so it's usually your family members that notice it first. But what I always recommend to my patients is starting at age 50 to get screened for hearing loss. Well, anytime before that, if anyone notices symptoms or you think anything is changing. But otherwise, if you're not noticing anything, get screened at age 50, and then you should be screened every 3 to 5 years for the rest of your life. And it's because this correcting hearing loss with hearing aids has such a profound benefit in preventing dementia and a lot of other things like falls and balance issues, et cetera, that it's important to do that screening every 3 to 5 years and always either wear hearing aids or update your hearing aids with the new settings.
Okay, that's kind of interesting. So when your teenagers say, oh my God, Mom, do I have to repeat myself? then maybe you should get your hearing checked? Or is it?
Yeah. Anytime something seems off with the hearing, definitely get it tested.
Okay.
Yeah.
So that's one I wouldn't have predicted. Let's talk about cholesterol in general and why LDL matters. So, because I think most people maybe know what their total cholesterol was last time it was checked. So, and then there's the good cholesterol and the bad cholesterol. So why don't you explain that and what people can do about it?
Yeah, of course. So you have your HDL, which is your good cholesterol, and that helps your cardiovascular risk to have a high number there. And then you have the LDL cholesterol, which is considered your bad cholesterol. So that's the one that really has the strong link with dementia. So that's something where the recommendation is usually at age 25 to start screening for, even in a healthy person, to start screening for your cholesterol and checking your LDL. That usually comes out in a normal cholesterol panel. So if you've had your total cholesterol checked, your LDL cholesterol is probably in that panel. And it's just really important to, if you have high LDL, to do, first of all, the lifestyle factors to keep that down, like diet and exercise. And then if that doesn't work, then you want to take medications. And if I can say something about medications, because there's sort of this myth that is going across social media right now, that the medication statins actually cause dementia. And I just want to say that myth is not true, that it is very clear. And the Lancet Commission talks about this in the study that they published, that taking statins and lowering your LDL cholesterol likely decreases your dementia risk and not increases your dementia risk. So I just want to debunk that, because that's a common reason that people refuse to take statins, is because they have heard that it increases their dementia.
But it would make sense that if your cholesterol is really high and your doctors put you on statins, you're at higher risk for dementia because of your cholesterol, not because of the treatment for that. So that makes sense to me. Well, that kind of all leads to sort of like what's been in the news and everybody's talking about for the last couple of years, and that's GLP-1s.
There's no reliable way to know if a med spa is following safety standards or cutting corners. Until now. The Med Spa Board certifies clinics that prove they're doing things right. Verified products, licensed staff, and actual medical oversight. It's the difference between rolling the dice with your skin and knowing exactly who's holding the needle. If you're looking for aesthetic treatments, go to medspaboard.com to find a certified spa near you. And if you already have a med spa you love and they're not certified yet, please send them our link. Med spa owners, getting certified does more than build patient trust. It should also save you a ton on your malpractice insurance. Do the right thing and go to medspaboard.com. Keep listening, keep asking questions, and stay safe out there.
Because I know that for myself, I was about 22 pounds overweight, and I went on tirzepatide and lost that weight. And my cholesterol went down 40 points. And I always add kind of a high HDL, so the good kind. That was always high because I'm pretty active and athletic. So I'm curious to know your take on the GLP-1s and dementia risk. And it looks like maybe GLP-1s actually decrease dementia risk, but is that because of the drug themselves, or is that because of all the other things that go along with weight loss?
Yeah, so it's a great question. So the GLP-1s decreasing dementia risk is actually mixed. So that's not a solid thing right now. So what we have is many observational trials that actually show an association between GLP-1s decreasing dementia risk. There's a lot of biases in observational trials, and there's been 2 controlled trials called the EVOKE trials that have not shown a difference, and that's a stronger study type. So that's just 1 or 2 studies. So I think a lot more needs to be done. Plus, I think as a scientist and as a doctor that it makes sense that likely these drugs could do that. And so I think, they're brand new. I think we just need to watch the research. But what's interesting is that there are 2 other types of diabetes meds that definitely have a link with decreased dementia, and that is metformin and these other drugs called SGL. The most common one is called empagliflozin, also called Jardiance. Those drugs have been around for a long time, and we definitely see an associated link there. The other interesting thing is there's one diabetes drug that is associated with a higher increased risk of dementia. And this is interesting. These are drugs called sulfonylureas, like glipizide, glyburide. And the reason that those drugs can sometimes be associated with a higher risk of dementia is because they cause hypoglycemic episodes. So severe low blood sugar episodes. And having too many of those, especially in older age, can hurt your brain. And so, if you're using those medications safely, that's probably not a risk. But what you really want to avoid in treating your diabetes is going too low on your blood sugar, where you're shaky and you're not thinking clearly and you feel like you're going to pass out. That's a bad sign, and you want to sort of avoid those things. So I thought that was really interesting about the diabetes literature and dementia risk.
Interesting. Okay. Because I would think that anything where you get, closer to your ideal weight, you're able to move more, you're able to be more active. And, if that goes along with your normalizing of your cholesterol levels, that all those things would go towards, preventing dementia, which is why I just think GLP-1s are going to save probably millions of lives over
I
the
agree.
next 20 years.
I think that's probably how it will pan out. I would be surprised if it doesn't.
Yeah.
It's just, we don't have it strong yet, but GLP-1s are phenomenal for lots of things, including decreasing rates of heart attacks and strokes, decreasing progression to kidney disease, treating obstructive sleep apnea, knee arthritis, liver disease. There's lots of things that they're.
I think, as far as I know, the studies on GLP-1s that have been really good, trials have been only of the FDA approved indications. And so that means the only people that have been studied are diabetics and people who are severely obese. Yeah. And so for people like me, I was just up 22 pounds, I've found an incredible improvement in my health, but people like me have not been studied. And honestly, I think that people like me are really the vast majority of people who are taking these drugs. They're just, we're not taking them as part of a trial or being treated for diabetes or obesity. So I do think that hopefully those trials will get done eventually. I doubt there's funding for that. So that's one of the big problems, is for all the things that we talk about in kind of the wellness space that healthy people are just paying for out of pocket, they don't get studied because people are just paying for them. And so the drug companies don't actually study the problem. So I'm kind of hoping somebody does a trial.
Yeah.
It's got to be someone like you in academics who's going to actually design this. You'd think there'd be some big money behind that if they could actually get an indication,
Those trials just take a long time to do because we know that controlling diabetes in midlife helps your dementia risk later in life. But so you're doing something 30, 40, 50 years before the onset of disease. So that's why it's going to take a while to see that. But I am sure those companies are doing that dementia trial because dementia is one of the most costly conditions for our healthcare system. And if you can find a drug that decreases that, people are going to spend money on it.
Yeah,
so
for sure.
It's just going to take a long time.
We're going to take a long time to have the data.
Something here that affects things 40 years down the line.
Okay, so we've talked about two of the so many different things you can control. So what are some of the other things that you can do in the middle of your life that can decrease your risk of dementia?
Yeah, so we kind of touched on some of them: treating your diabetes, having a normal body weight, and then treating high blood pressure. These are all common sense things. And then avoiding physical inactivity. So those are some of the big ones in midlife. So these are just the normal things that doctors say all the time. It's not sexy. You don't see it all over social media because it's not saunas and cold plunges and all these fancy things. It's the simple things that we've been saying for a long time, but all of those things have a very strong associated with decreased dementia risk.
So, getting closer to your ideal weight, being active,
I mean, have you found that giving advice as a physician to do these things has actually translated into people actually doing them? I mean, do people follow that kind of advice or?
It's interesting. I mean, a lot of these things are hard lifestyle changes. Even if you're using like GLP-1s, they're expensive, right? And so some of these things, especially if you're going to stay on them for a lifetime. So, I think these things are hard, but there are people I do, on my social media accounts, I do get people saying, I got my hearing screened, I started walking every day. So I think here and there, people do take advice, but I think everybody wants the quick fix. And like we know, for instance, the dementia risk reducer of exercise is it's something that you have to do across your lifetime. You don't have to do it every day, but you want to stay active every decade of your life. And what you do in your 20s and 30s will determine a lot of how things are in your 80s and 90s, right? So I think that's what's hard. That's not an easy thing to be consistent with over a lifetime, but that's what has the strongest evidence.
It's not something you can prescribe exactly. I mean, I guess you could hand out a script for exercise. And
right. I do that sometimes. Yeah.
Yeah. I remember there was a lecture in med school. This is, of course, a very long time ago, but we were talking about smoking cessation. And there's a whole lecture of all the things you could do. But then at the end of the lecture, the guy was like, well, no matter what you say or do to tell a patient to quit smoking, you have a 1% chance of succeeding in getting them to quit smoking, regardless of what you offer them. I was like, well, that's pretty defeating.
Yeah, it's not like but everybody who smokes knows. It's not like we're telling them something they don't know,
Right.
like there's other reasons they smoke. And so these behaviors are complex behaviors. It's not usually about not having the knowledge.
Right. I'm assuming that quitting smoking's on the list somewhere.
It is in midlife. Yes.
So, okay, everybody, if you're not already, I mean, I feel like, I don't know, this is probably geographical in the US. Here in Seattle, very few people smoke. I'm assuming in San Francisco, it's very similar. But you go to parts of the country and it's very smoky there. And it's almost shocking to my system to see, it's kind of like the 80s back before, when like every restaurant and bar was smoking and you'd come home every night if you went out with like smoky clothes. Ugh.
Yeah.
You can tell I'm very biased again. So if you do, I doubt too many of our listeners are smokers, but if you are out there, that would be my number one piece of advice, not just for dementia, but for all the rest of your health.
Agreed.
So what are some of the other things on the list? Because it's kind of a long list.
Yeah. So I'm going to see if I can come up with the rarer things here. So alcohol consumption, meaning excessive alcohol consumption. None is probably better, but what we do know is excessive drinking, including like if you've ever passed out or you've forgotten different evenings, that is associated with an increased dementia risk.
Even just one time of that?
That's a good question. I would have to look that up. It's probably dose dependent, but I'm not sure off the top of my head.
So just to ask you more about that. So, back in the day, people were talking about having like 1 glass of red wine a day as being actually helpful. Is that a myth? Does that make any difference whatsoever? And does 1 glass of wine a day matter for dementia?
So in the current studies, 1 glass a day doesn't matter. It doesn't look like it's helpful. Some of that data that came out where it showed that it was helpful, they found in those studies, they were sort of biased because they were people who had been excessive drinkers that then cut down to like 1 or 2 drinks a day. And so it looks like it improved things. So at this point, it doesn't appear to be harmful for that, but probably not helpful.
Okay.
Like
Interesting.
Yeah.
I had a patient when I was an intern who was like 92 and was admitted for something very minor. I can't remember. It was probably IV antibiotics for a UTI or something. Super sharp, amazing, independent, totally healthy 92-year-old. And one of the things she told us was that she had a glass of red wine a day. And in the hospital where I was, we could actually prescribe that as part of her diet. And we were
absolutely. We were like, well, there's no way we're making her withdraw from that while she's here.
Yeah,
So we
it's
were
true.
striving. So she got a glass of red wine every evening with her dinner in the hospital.
wow.
And I was like, okay, I don't know. But I've always been curious about that. My grandparents were all kind of, one martini a day people.
Mm.
And it's like, okay, don't mess with that. They were smart till they dropped dead, right? So like,
Yeah, which is to say for all these things, like, you got to be happy and you got to live a good life. Like, it makes no sense to like be miserable and work out all the time and never drink and never have potato chips. And you know what I'm saying? Like, it's all a balance of like, and if you love your glass of wine at night, go do it. I mean, I work with lots of older people and I see a lot of doctors being like, and I'm like, they're like 96. Let them eat. They want a milkshake right now. Have the milkshake.
Seriously, it's been working for them. They're 96.
Exactly.
I think that we all should just, I know. I think that's really important. Back in many years ago when hormones were not recommended for women, now we love hormones. But for many years, especially when I was in the breast cancer world, everybody was like taking off their hormones. And a lot of those women were miserable, and they couldn't sleep and they had, depression and they were in. And I would tell people, I'm like, look, you might potentially live a little bit longer if this somehow prevents breast cancer for you. But what's the point of living longer if you don't want to live, if you're miserable?
Right.
And I think that is so important. And now, thank goodness, we proved that trial was wrong and like everybody's back on their hormones and everybody's happy. So I think that's really important too, to,
agree.
got to be happy and healthy.
Yeah.
So that's interesting. So I'm kind of curious, like, so many of our audience is, people who are interested in aesthetics and wellness and longevity. And are there any other habits that help people age gracefully, I should say, besides dementia, which clearly is, really important? Is there anything else that you've seen that really helps people age gracefully?
Yeah. 2 points. One is, I think, especially in midlife, we kind of have this view of like, I'm getting older. I'm going to be miserable. This is going to be a horrible experience. But the research actually shows that there's a U-shaped curve to life satisfaction. And the nadir, the lowest point, is actually midlife. And so our life satisfaction and happiness is going to continue to increase into older age. So I just want to put that out there because I think that's encouraging. We sort of think it's like this, but no, if we're in midlife, we're at the low point. And that's because we're in the sandwich generation. We've got kids, we've got parents we're taking care of, we've got jobs, careers, but things will get better. But I will say that one of the things that is not talked about enough to help you age well, and it also decreases dementia risk, is social interaction. It is extremely clear that having social interaction and avoiding loneliness can have profound effects on how long you'll live and also the quality of your life that you will live. I don't know if you remember a few years ago, the Surgeon General actually picked loneliness as the thing that he wanted to target because it's such a strong factor. And so, I'm an introvert. I have to really work at this. I could spend days alone in my house and never talk to another human being. But I try to at least once a week go and do something with friends. And it doesn't always have to be in person. So FaceTime and talking on the phone is also just as strong. It's more about the depth and the meaning of the relationship. So if you have a really great conversation with your best friend on the phone, that's just as strong as like going out to dinner with a bunch of friends. And I think in this day and age with the internet and FaceTime and all of those things, like we're getting away from that. And that is just as important as exercise and diet, is maintaining a strong social circle.
I totally agree. I mean, many years ago, I took the Yale happiness class. So Lori Santos, who has her own podcast, The Happiness Lab, she did this whole class at Yale. It's called The Science of Well-Being. And then she launched it on Coursera after a year or two. It was the most popular class at Yale ever. And back when I was an undergrad, and we had a shopping period, and you could check out any class. And then after 2 weeks, you just sign up. And her class was so popular that they had to move it into the biggest space on the entire campus, which was a chapel, actually. But anyway, so one of the many things that is studied in the realm of positive psychology is that social interaction. And there was some study, I was listening to another podcast about this, and it was like this challenge to, strike up a conversation with a stranger every day. And it might lead somewhere, it might not. But the person talking about this was the professor who had his students go out and do this as part of the class. And there were, a slew of introverts in the class were like, oh my God, you could not pay me to do that. But he was like, no, you got to do it. And they overwhelmingly reported back that it made them happy. Like, it was delightful. And like, they'd have some interaction that just was completely unexpected. And I don't know if this relates to dementia, but it definitely relates to contentment and gratitude. And I just think that has been like the biggest thing for me is striking up conversations randomly. Now, I'm a total extrovert, so that's not too hard for me. I just kind of naturally do that. The introverts of my life are like, what are you doing? I'm like, I don't know. This next person might be my new best friend. But yeah. And so do you think that those things relate to dementia as well? I mean, what are your
it's one of the 14 factors. There's 3 factors that make a difference in late life in particular, and social interaction is the strongest one in that category. So it's definitely a very strong association with dementia as well.
And what are the other 2 that are late in life?
So the other one, I'm going to forget the third one, but the second one there is vision loss and not correcting your vision loss. So very similar to hearing loss. If you have cataracts and you don't get cataract surgery, where you're not wearing your glasses, et cetera, your brain sort of, and this is how it works for hearing loss too, shuts down parts of your brain. It's not getting as much, feedback, and those parts of the brain can atrophy. And that's probably why it's related to dementia. The other reason, like hearing loss and vision loss, they're similar, are associated with increased dementia risk is because they cause social isolation. And social isolation in itself is a risk factor for dementia. So it's multiple factors there.
Right. So making sure your senses are clear.
Yes.
As I adjust my reading glasses, which, a lot of people are in denial about that, I'll tell you. I know that in my 40s, I was like, oh, please, I don't want to lose my vision. And then, by the end of my 40s, I cannot. So, and of course, also I need it to look at a screen, which is why in these podcasts, I rarely take them off because now you're all blurry. That's kind of sad.
We got to destigmatize these things like hearing aids, glasses. They're cool. They're cool because they're going to help you live a long, very healthy life.
Yeah, absolutely. I think that's so important. What about, I'm so curious now about the brain games and puzzles and stuff like that. Like, what do you make of those? And are any of those, is there any data behind that?
Yeah, unfortunately, that data is disappointing. So brain games and brain skills, they show short-term benefits in just the skill that you're doing. So if you're like doing crossword puzzles or whatever, you might get better at crossword puzzles, but it does not show a decreased risk of dementia or cognitive impairment. So there was a lot of companies like 10 years ago, apps like trying to get these brain games going. And unfortunately, right now, the research has not played out on that. I mean, it does help you get better at whatever game you're playing, but no association with dementia risk right now.
Okay, that's interesting. I feel like the New York Times should sponsor a study for that because so many of us are addicted to, I have to start out with spelling bee every day of my life.
Oh,
and
yeah.
I can't move on until I'm genius in that. And then I can do some other things.
Wordle. Yeah.
Yeah. I just think that those are really interesting. So that's a little disappointing since I do those every day.
Yeah, that is. Okay. It's really disappointing, actually.
Are there any other longevity things that are trendy right now that seem to be promising? I mean, I know that none of those things have really been studied, but
Does anything look promising from that world?
Yeah. So, I get asked a lot about supplements and like, what supplements should I take to help me live a long life or live a better life? And my answer is mostly none. The one things that I will say, maybe if you lift weights, creatine actually has really good evidence that it can help you improve muscle mass. There's maybe some signal that it could be helping cognition. That's not strong yet. We need more studies there, but maybe there's something there as well. So creatine, if you don't lift weights, there's really no reason to take it. It doesn't help you. But if you do, that one I agree with.
If you're lifting weights and doing creatine, how does that help your brain?
Yeah, so supposedly it's supposed to provide more energy for your brain cells. But like I said, that research is still mixed, but there's a trend towards like it might be doing something. So I would definitely say in the next 5 years, I think there's going to be some big studies on creatine and dementia coming out. So I would keep an eye on that. I think most of us are pretty bullish on that maybe panning out.
Okay, well, that's exciting. I do that.
Yeah. Oh,
and
great. Well, there you go. I do too.
Exciting.
I do too.
Not that I'm good.
Yeah. I only say things that I usually do, but I do that too because I lift weights. So, yeah.
So what about sleep? Like, is sleep quality, does that matter? And like the amount of REM sleep, deep sleep, has that been studied? And is there anything people can do about that?
Yeah. So nothing is super strong with the dementia risk, although it's not one of the 14 factors that are like the definitive, very strong factors associated with dementia. But there's a lot of research that says that it's probably helpful, and it's probably helpful for cardiovascular risk and all those other things. And the sleep component that has the strongest evidence is actually a stable sleep schedule. So, things like sleeping 7 to 9 hours is also great. But what's even stronger than getting a consistent 7 to 9 hours is keeping the exact sleep schedule. That actually has the strongest benefit. And then what's also interesting is if you sleep more than 10 hours, that's actually worse outcomes. So you don't want to sleep too much. You want to stick within the 7 to 9 and try to keep a very regular schedule.
Okay, interesting. And do you think having the wearables, the Oura Ring, or any of that, does that make a difference? Does that help people keep track better, or you just think,
It definitely can help you keep track better. Although I think a lot of the sleep researchers and sleep doctors don't recommend doing that because it actually causes more anxiety around sleep. So I think a lot of these sleep trackers, you get a lot of different things like resting heart rate and heart rate variability and REM, et cetera. And it has been showing to give people more anxiety about sleep. So I would say just if you track anything, just track, I'm sticking to a regular schedule and I'm getting 7 to 9 hours, and everything else, don't worry about because it's going to cause worse anxiety. People will just worry about sleeping more and then they don't sleep.
Well, I don't know that. I mean, I just can report on my own experience because I do have an Oura Ring, and I've dealt with insomnia ever since med school because, that really messed me up. But what it helps me to do is know, like if I wake up and I haven't slept that late, like I've slept 5 hours and I'm awake and I look at it and go, oh, I need to go back to sleep. And I go back to sleep, and I usually get more sleep then. Whereas before I would just kind of get up and keep moving because, I'm like a doer. I got to do things. So it does kind of help me go, oh, I got time. I should go back to bed.
Yeah, I can see how that'd be helpful. Yeah, definitely.
I find that helpful. And then on the occasion when I am really messed up because of something, I also kind of know, okay, I'm totally taking it easy today. Maybe I won't work out or whatever. But it's true. Like if you're constantly obsessively looking at the app and worrying about it, then I can't imagine that's helpful at all.
Yeah.
What are the biggest myths? Are there any myths about dementia that you'd like to put aside for people? Is there anything that people just believe and we want to debunk that?
Well, I think we talked about that. Like a lot of people think it has such a strong genetic component that there's nothing that you can do. And there definitely are genetic cases, but I think we talked about that there's actually a lot that you can do, and especially the earlier in life that you can do it. So 20s, 30s, the more of a benefit you're going to have in life. I think the other big myth that's sort of out there, it's not really a myth, it's just not so much stridence, is like a lot of these drugs that are coming out to, quote, treat dementia are not actually showing clinically significant benefits or changes in cognition. I mean, maybe they can demonstrate a statistically significant difference by like changing the score on an exam by like a point or two. But when you actually talk to the patient or families or caregivers, they notice no difference. And a lot of these medications are very expensive and they have a lot of side effects, and some of them are monthly infusions and you got to get MRIs all the time. And so I think I'm hopeful that there will be a drug out there someday to treat dementia for those of us that get it. But right now, the current drugs that are out there are, I personally, I always, I talk through it with my patients, but I don't strongly recommend them.
Yeah. And I think when, the last one that got approved, I think there were a lot of people who are like confused as to how that even got approved because.
Yes, exactly.
Yeah. It just seems like a way to charge people money in the last few years of their lives.
We mean well, we're trying to find drugs, but all these things are targeting amyloid, and it's just not panning out. It's not, it's not panning out yet. So I think we really need to be looking for different targets. And maybe it's the GLP-1s. Maybe, we definitely know all these things, controlling your blood pressure, controlling your diabetes, et cetera, that has a profound effect. So that's where you're going to get your bang for your buck.
Okay, so let's summarize this for people. So for anyone in our audience, what should they have on their annual checklist? So besides diet and exercise and staying healthy, we're talking hearing, vision, cholesterol,
blood pressure, your diabetes check, which is your hemoglobin A1C. That's always definitely there. And unfortunately, controversial in this day and age, but vaccines. So the flu vaccine is associated with a 40% reduction in dementia risk. And the shingles vaccine, which is at age 50, is a 20% reduction in dementia risk association.
That's huge.
It's huge. And it's likely because when you get those infections, you get huge inflammatory effects and it affects your brain. And so when you can sort of prevent or lessen the disease, it can have an effect on your brain. So I stick to the vaccine recommendations that are put out by the expert panels.
Yeah, absolutely. And I mean, really, if you've had the flu or COVID, you don't want those. I mean, it's terrible. We do not want them. We want to stay healthy. Do you have any thoughts on having an anti-inflammatory diet? Do you think that makes any difference?
Yeah, it's a good question. I haven't done a ton of research on that. I mean, again, for me, that's always something when I'm like, we're trying to ask people to make lifestyle changes. It's like so hard to stick to a lifetime of something like that. So it's always for me, like, is that really sustainable for you? If it is,
you can't get people. Yeah, you can't get people to do that unless they're suffering from something that gets a lot better with an anti-inflammatory diet. So, I mean, I generally have an anti-inflammatory diet. I had this chronic cough that basically 95% went away as long as I stuck to the diet. I've had, one close friend who's got Crohn's disease who completely manages it with an anti-inflammatory diet. I've had other friends with various autoimmune diseases where they can actually manage that with anti-inflammatory diet. And, in general, if you've got inflammation, if you go on that diet, you have less inflammation. You're not feeding it, right? Yeah. So, but this is one of those things where we don't really understand the processes that create the dementia in the first place. It's a little bit of a mystery. And so, could it help? Maybe. Maybe
it would help. Inflammation is such like a complex pathway. When we're in biochemistry class, there's like hundreds of IL-6 and IL-1 and like cytokines, and like there's so many things that go into it. I think someday when that all gets teased out, I think there's definitely something there.
Yeah.
Well, thank you so much. This has been so interesting and kind of an interesting departure on the podcast, but I know that our audience is very focused on staying well as long as humanly possible. And I know that for me, thinking is really important, staying sharp. So I really appreciate all the information you've been able to share today. Thank you.
Of course. Thank you so much for having me. I appreciate it.
Thanks for listening. If this episode opened your eyes to something you didn't know before, share it with someone who needs to hear it. Subscribe so you don't miss the next one. And drop a comment telling me your biggest takeaway. I actually read them all. Join me on this mission to keep you safe and push this industry to do better.